Injured workers in America face numerous challenges when seeking compensation and medical care. This video explores whether our doctors and vocational services are truly working to help injured workers, or if they are part of a system designed to deny and save costs. The first question we need to ask is whether doctors are looking for that sliver of objective medical fact to support injured workers, especially in non-catastrophic cases. Or are they trying to find reasons to deny claims, ultimately saving the state and businesses money on workers' compensation rates? This issue is particularly concerning given that many doctors are influenced by the insurance cost containment industry, which prioritizes profits over patient care. Similarly, vocational services have shifted from helping injured workers return to suitable jobs to shopping for reasons to deny claims. Vocational services have been privatized in most states, leading to a focus on reducing costs rather than supporting workers. This privatization has resulted in a system that often disregards the unique needs of injured workers, further complicating their path to recovery and financial stability. The impact on injured workers is profound. Denied claims and delayed compensation lead to financial instability, often forcing workers into homelessness. The rise in homelessness over the past 30 years can be linked to the practices of the insurance cost containment industry, which prioritizes cost savings over the well-being of injured workers. To address these issues, we must call for basic federal standards that ensure all workers are protected, regardless of state or industry. We need a new National Work Comp Commission to investigate systemic failures and hold those responsible for denying care accountable. The healthcare system should not be a tool to harm injured workers, while those inflicting the harm hide behind state medical tort laws and private insurance policies. Join us in demanding accountability and justice for injured workers. We need a system that prioritizes patient rights over profits and provides a clear path for injured workers to receive the care and compensation they deserve. It's time to end the class war on labor and injured workers and ensure that our healthcare system works for everyone. But the burden of change doesn't fall solely on the shoulders of lawmakers and insurance companies. Doctors, who are often unwittingly used as tools by the insurance industry, need to be held accountable as well. State medical boards, who frequently turn a blind eye to the wearing down of injured workers in order to deny them, need to be scrutinized. There's a systemic issue of misdiagnosis, such as coding a herniated disc as a mere sprain, which is considered standard care. This is not just unethical, it's detrimental to the recovery of the worker and ultimately contributes to the cycle of injustice. Proper medical care and treatment from the start can make the difference between a worker's successful recovery or a lifetime of hardship. Wrongful and intentional denials of care only serve to exacerbate the problem. If a doctor's oath is to do no harm, then we must ask, how is denying care and prolonging suffering doing no harm? It's time to hold doctors and medical boards accountable for their role in the struggles of injured workers. They must be a part of the solution, not a cog in a machine of injustice. Let's join together to demand more from our medical professionals and the systems that regulate them, because in the end, we're all just one accident away from being an injured worker ourselves. As we delve deeper into the plight of injured workers, we uncover an even grimmer reality: homelessness. Estimating the exact number of homeless individuals in the U.S. over 50 with mental health conditions awaiting SSDI, VA benefits, or workers' compensation can be challenging, as these statistics are often tracked separately. The National Alliance to End Homelessness reported in the 2023 point-in-time count 138,098 adults over the age of 55 were homeless. Nearly 25% of people experiencing unsheltered homelessness were over 55. Furthermore, about 26.2% of sheltered homeless people have severe mental illnesses, and about 30% of chronically homeless individuals are grappling with mental health conditions. Behind these numbers are real people, many of whom are injured workers denied proper medical care and compensation. The lack of adequate housing, high medical costs, and untreated health conditions exacerbate the risk of homelessness for these older adults. This is a direct consequence of the systemic problems we've discussed, showing how the plight of injured workers extends far beyond the immediate physical and psychological impact of their injuries. These statistics provide some context, but additional data would be required for a more precise estimate of the number of homeless individuals over 50 with mental health conditions awaiting specific benefits. You may find more information through the National Alliance to End Homelessness, the United States Interagency Council on Homelessness, or similar organizations. Remember, these are not just numbers. They represent the countless injured workers who've been left out in the cold, quite literally.